Welcome to HealthTech Grow, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.
In some type of journey of life, we all know it's not just us. We have our families. And what does a family really mean to all of us? The child, the mother, the father, the entire family support in this journey. But having children in and out of school when they're getting sick, and parents have to take time out of their days to actually care for the child, it has been difficult for anyone. And then we know some, even the most established leader having these challenges of caring for our family member. And we're so blessed and excited to have Lyle here with us. He is the president of Perfecting Peds, one of our Impact Award winners from 2024. Congratulations, along with your co-founders and all your entire team for showing up, for giving us a great presentation and having our experts and investors to say, hey, there's someone we are really interested to see and to see how they continue to grow. So thanks for being here with us. How did everything feel to you? You know, in this phase of you guys, you just close your C round, pitching and getting yourself out there, talking to a lot of people. It's kind of like an everyday game, right? So how did it feel when you gone through the Impact Award and finally got this win?
Well, obviously it felt good. We think that we're doing impact every day. I think our patients, their caregivers and family alike would say the same. And that's from individual to individual and also as a business. So to get the award was affirmation of some things that we've been feeling internally for a while. It's been a long time coming. So Perfecting Peds was founded 3 years ago. We really started hitting scale and hitting populations at scale just recently. And so to be recognized already, we can't ask for much more than that.
And I believe it's a good timing is because you guys have this big contract, you're really dived down to enrolling users, moms, right? Like to get them the resources they really need, perhaps they never know. And I think that's why we healthcare innovators are so driven, right? So passionate about each of the solution that you guys bring that is it, right? There's the ups and downs. There's probably 10,000 meetings that you guys got finally closed around. And now we're in the trenches of doing something fun, right? So tell us more about that. What is the project looks like? What is Perfecting Peds? How is it serving the community?
Yeah, I mean, just to answer the first part of that, it's been a lot of, it's probably a bad word to use, but angst, right? We've had this solution of pulling a very acute resource out of hospitals where they've been exclusively reactive in nature, and the resource is a pediatric clinical pharmacist, realizing that their impact can be more long-term, more traversing across subspecialties and the different prescribers that complex and high-risk kids have on their care team. And so we've spent the last 3 years doing this at smaller scale, doing this in facilities like skilled nursing facilities and rehab facilities, proving out that when we have someone who's helping to optimize the medications and provide safety, good things happen. So it's keeping kids out of the hospital at a really great rate, decreasing the amount of unnecessary medications that they're on, and just providing a lot better quality of life for whether it's moms, dads, foster parents, any caregiver, whoever's taking care of that individual. Even themselves, because we see patients up to the age of 24 has been helpful. And now we're doing it on behalf of a health plan, helping them distill down who the population is that needs the most help, which is something they struggle with when it comes to pediatrics. It's such a small portion of their overall risk profile, but we're highlighting that for them and then offering the service to really mitigate some of those issues that we're surfacing. So that's been great. We're at this point again. You mentioned it. Thank you. We closed our seed round of funding. We were able to successfully raise $3 million to get Perfecting Peds off the ground into population health. To kind of transition into what we are and what we do, I kind of hinted to that a little bit, but simply, We are a longitudinal comprehensive medication management service, meaning if you have a child who has high-risk medical conditions, high-risk medications, or even just complexity in your medication regimen, we place a single care provider and board-certified residency-trained pharmacist on the care team to coordinate across all of the subspecialties to understand, is your child on the right medications to begin with? Are they being dosed appropriately? Do all of their prescribers know anytime one of them makes a change? And is that change jiving with all of the other dynamics of what goes on in a patient's care cycle?
Yeah, which is amazing, because I feel like you guys know the health plans have the most struggle. And so you are directly connecting to the people who already feel the pain. So you have a better understanding of what your market needs, and then targeting, meeting them exactly where they are. I think sometimes that's the struggle, is we see a lot of application for what you guys can provide, right? A lot of people have all different type of user and product usability. Now, could hospital use this? Absolutely, right? Like, now you guys are niche into the health plan. So then you have this contract. Now you can duplicate the same when it's successful. You collect your data and show improvement of the health outcome. You can do even more of that, right? And then I think one of the lessons for everybody is like, don't try to chew up too much, right? When you are having this momentum, let's keep the momentum going. And that's how you start seeing the joy and the fun and really validate, right? Yes, for Perfecting Peds, for you guys, yeah, we give you the thumb up because we really like you guys by seeing the 12 different area of business, because we know, especially we run this competition end of year. The reason not just we wanted to bunch of applicants, right? The reason is for people to start thinking about, oh, I do have to structure my business in these critical domains. I can't just write it somewhere and forget about it, right? I kind of have to reflect on it. So it's an opportunity for people to learn and to then use it into getting a clear path for the next phase as they going into Q1, Q2. For you guys, we know our different steps are simple application, getting you pitch in. Sometimes it's really hard, right? Filming you guys, I get using existing promo videos, and then understanding your past. And then we ask you what? Go promote yourself, right? Like getting the world to really get ready to support you, right? So how did that whole journey felt to you when you have to take some time to reflect?
Yeah, I think you hit the nail on the head with regard to focus. So there are constant distractions when you're starting something, or even like just in previous experiences working in business, there's always another company who has a great idea, and you might be able to do some sort of B2B business development sort of relationship. At the end of the day, we know that our North Star is one very specific thing, and it's to optimize medications for pediatric patients. We've learned over the last 3 years of just testing product market fit where that's scalable. And for us, and this doesn't go for everybody, but for us, it's at a population health level. And there's really only one type of entity that can have a population large enough to distill down to the kind of complex cases that we like to help with. And so the realization that we must work with health plans, we must look at their entire population and then distill down, has been an aha moment for us when we've been frequently distracted by, gee, should we get out on the internet and do webinars for parents across the country to private pay for us? Like that creates barriers on cost and affordability and reach and all of the things that come through with doing kind of onesie twosies. And so that's just one example, but there's many. Everybody has a great idea of what you should be doing with your business versus what you already are. And like my recommendation to that is always think about the North Star, know what your utopia is. We talk about it obsessively at Perfecting Peds. And at this point, we've got the blinders on to everything else. We know we're doing something that new. We have this blue ocean idea, and we're set forth on achieving it. And it's happening right now at scale. So several health plans across the country, we're just kicking off with thousands and thousands of patients at a time. The outcomes, they spoke for themselves when we were in proof of concept. And what I'm starting to see now at the population health level is it's unbelievably remarkable health outcomes. And we're getting ready to already publish some of them.
Yay, they're so exciting. So I have a MPH as well back in the day in Philly at Jefferson. So work in some of the trenches of going to communities, assessing, right, geo-mapping of the problems and then proposal. So it's definitely, I feel like the world start getting smaller because we have solutions now. And then it's not just regional, right? You guys are with health plans, but now we can get the public, right? The family, the moms behind it, and leveraging what they are already trying to search on the internet and give them the solution. Now they can take it back to the right people to actually search and ask for these right resources. So it's much more powerful in how we can create a better, sustainable healthcare nowadays. Now, we are always loving partners and co-founders who also have women leaders and board members, and you guys have plenty of those. So how have that journey been, having women partners and co-founders, CEOs, and helping you guys to acquire perhaps more patients or contract or funding?
Man, all of the above. I wish they were here with me. I'm going to do this an injustice. I'm one of the very few men at our company. So I'm a registered nurse by background. Most of our team are either registered nurses or PharmDs with pediatric board certification. They're mostly women. Our CEO is a woman. She's the majority owner of the company. Our chief of staff is a woman. And I think it's done a lot of different things. One, it attracts a different type of talent. We seem to attract and retain a lot of like-minded individuals that have the same drive as our CEO, the same outgoing and charismatic personality type. They're drawn to that, and that in turn is drawn to Perfecting Peds. And so that transitions into every aspect of the business, whether it's us, how we're interacting with parents and patients at home, or when we hop on a call with a health plan or a vendor that we need to be working with. I think that the milieu, when it's diverse, it's helpful, and we have different perspectives. I also believe that it lets the guard down a little bit. You know, I hate to dog on all the other guys out there, but when it's a bunch of just men sitting in a room in a meeting, it's a very different feel than when we have a diverse group of people, and especially if we have a woman leading that conversation. I love the way that we have structured things at Perfecting Peds, and I think our customers, each type of them, and partners would say the same thing.
Yes, what I'm hearing also is the culture that you guys are able to create, right? Like, I think most of the time when we think about investing and then getting partners as GPs, one of the things people don't talk enough about, even though they know it's critical, is human capital. And for you guys are able to create that amazing culture and human capital, and that's the driving force. Because at the end of the day, people do business with people. Yes, we're all finding the best solution, the best workflow, but still the people behind every single idea, that's what we love to buy into, right? And that's the major trust that we're creating. So we're so excited for you guys. Now, for people who are going through these competitions, right? We run a bunch of them, and it's not just pressure test people, but really get them to a more of an exciting state, right? And then so they can get to even next level of recognition that they so deserve. So for people who are not ready to enter a competition, what would you say to them?
If it's women specifically, it would be true to yourself. We don't have a culture here where like we prioritize stoicism. So everybody gets to be themselves. We totally recognize that the people that we serve on a day-to-day basis are also moms and dads. And so we're constantly thinking about, from an empathetical perspective, how is this interpreted by our customer? How is this interpreted by our end customer? How would I want to be treated about my children? So not all of our staff has children and our parents, but a good majority are, including our CEO. And so we're constantly drawing from our own personal experiences, sharing those internally and talking about what that feels like as a parent, and then going back out into our customer ecosystem and trying to replicate that and build rapport with our customers based on that genuine, I'm a parent too, and it sucks navigating healthcare right now, especially when you have a kid that has medical problems. So how is that transversed outside? I think it just has transversed into success. Like we've experienced, I think when you start something out, you're very optimistic and you're like, we're going to make it, but like, it's actually happening now. It's been this angst. We're going to do it. And I think the reason we are doing it right now is because of that culture. It hasn't been diluted. It's probably been elevated every month that we've been going.
That's amazing, right? That's what we all wanted to hear. It's like you feel the elevation. Everyone sees the elevation. Now you guys are ready to already demonstrate the elevation that you are creating, right? And so I'm excited to see how you guys are even moving forward in the next few months as you are start onboarding all these users, the moms, and to be able to use these benefits, and how the next phase of the company really looks like, right? So congratulations again at winning the 2024 Impact Award. We can't wait to see all the other amazing things. As we close up, what would be one thing you would like the audience to take away?
I think if you have a good idea, don't give up on it. I said blue ocean at the start of our conversation, Sabrina. I've been riding on that since I came across the idea of Perfecting Peds. You don't have to create something new. It doesn't have to come out of thin air. It doesn't have to be sexy. It doesn't have to be the market leader. But if you can reorganize things into a way that is efficient and valuable to a customer, make it convenient for them, create buyers where there aren't any before, you don't have competition. Not that we won't, and there's enough pie and enough sick people to be navigated for all of us. But if you have an idea and you believe in it and you can do those things and stay true to like those kind of ideas, go with it and don't give up. It takes years, and build slowly, do it on the side. And when you can figure out a way to either take in capital to fund yourself and to continue to do it and proliferate it out into the marketplace, just go for it.
Yes, just go for it. When you know, right, that's your purpose, that's your true vision. And we discuss this all the time, is we have to have alignment and true to ourselves. And when we bring on these partners, we need to make sure our core value, our vision is so aligned, because it's okay sometimes that we have to part ways. But from the beginning, let's support each other in the journey that we're on, and it become much more ease and healthy and fun all the way through. So we appreciate you from joining the conversation, giving other people the inspiration, and can't wait to see all the other amazing things that you guys have provided. So until next time.
Thank you for listening to HealthTech Growth. If you're a healthcare tech innovator or founder interested in being a featured guest on our show, visit healthtechgrowth.io to learn more.